Hi, everybody. Welcome to this episode of the One Thing Podcast. I'm your host, Dr. Adam Rindy. In today's episode, which is episode 104, we have the honor of hosting a truly remarkable guest, Dr. Amanda Lynn Hoffman. Dr. Hoffman is the first naturopathic physician with Marfan Syndrome to specialize in this field. Dr. Amanda Lynn offers valuable insights for both individuals living with Marfan Syndrome and their caregivers. As a naturopathic medical student, she wrote her clinical thesis on Marfan Syndrome about her personal journey, and she has compiled this information not only in a booklet for many people dealing with Marfan Syndrome and other connective tissue disorders. She's also now a specialist helping patients deal with the day-to-day quality of life issues related to Marfan Syndrome. In this episode, we dive deep into the world of Marfan Syndrome, exploring key questions such as the biological drivers of Marfans. We understand the genetic and biological underpinnings of the syndrome. We discuss symptoms and findings, the unique cardiovascular sequelae that is dealt with in Marfan Syndrome, including surgical interventions that are given to Marfan's patients. We discuss the emotional and physical journey of dealing with day-to-day life of having Marfan Syndrome and holistic approaches that can improve the quality of life. There is some unique physiology that we get into about what happens in the body when someone has Marfan Syndrome, and we'll discuss ways that is addressed in this episode. This episode had special significance as it was recorded just before Dr. Amanda Lynn underwent her David 5 heart surgery, and we discussed her thoughts and experiences leading up to this major surgery. And I'm thrilled to announce that Dr. Amanda Lynn is now recovering from her surgery and appears to be doing well post-surgery. And this was such an honor to be able to discuss the upcoming surgery with her during our discussion. So whether you're a medical professional, a caregiver, or someone who's living with Marfan Syndrome, this episode is extremely valuable, has good knowledge, and also I think just hearing from Dr. Amanda Lynn is quite inspiring. I will mention that we have done a special thing for this episode. We put a link to Dr. Amanda's support guide for all things that are generally not talked about with Marfan Syndrome patients. She also, in this booklet, talks about vascular Ehlers-Danlos syndrome and Ehlers-Danlos syndrome and hypermobility spectrum disorders. And this link will be in the show notes for you to download. Also, if we hit 300 listens within the first 30 days of this episode launch, the One Thing Podcast will make a donation in honor of Dr. Amanda Lynn to her favorite nonprofit right now, which is commongroundscollective.com, which benefits those who were affected in the Maui fires. And so proceeds and a donation will be made in her honor by listening to this episode. So I really appreciate you being here. Please share this episode and subscribe to future episodes on all your favorite podcast players. And without further ado, welcome to the next episode of the One Thing Podcast.
This is the One Thing Podcast, and I'm your host, Dr. Adam Rindy. The One Thing Podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine. Dr. Amanda Lynn, welcome to the One Thing podcast. It's great to have you here with me.
Oh, wonderful to be here. Thank you so much, Dr. Adam.
You're welcome. Yeah, so it's been great getting to know you a little bit more offline here. And I think there's just so much to share. And one of the things I'd love to hear, because we didn't really get into this, is just to hear sort of your journey. We're going to learn a lot about Marfan's, and I'd love just to hear your journey with Marfan Syndrome and take us back to this part of your life and when it started.
Oh, yeah, happy to. With me growing up in a small little rural part of Oregon, I was pretty lucky we were close to OHSU. Definitely. Lynn had already found the fibrillin gene at that time, and the hub was definitely going on up in Portland at OHSU about Marfan syndrome and down in Palo Alto at Stanford were two of the big hot spots. If you were going to need support, those were the places to go. But it wasn't until I couldn't see very well in like second, third grade, they started to pick up, oh, she's squinting a lot and not quite being able to read the chalkboard, what's going on. So it was actually a lot of us, it's our ophthalmologists or optometrists that are finding our diagnosis of Marfan's happening, which is pretty cool. I guess it's the dancing iris, the fluttering iris that really is very unique for us. And then they go in a little further and they're like, oh, you're only looking through a sliver of your lens. What's going on here? Because usually the loose microfibrils will pull you to the side one way. I was pulled, so they were way up here, and I was just always looking down the bottom edge of my lenses until just 2 years ago. So he had referred me to go get worked up at OHSU.
And you were what, age at this time?
I was, 8 years old. Exactly.
Okay.
Yeah, so I was far enough along that, and I didn't have it as bad that I skipped over like all the casts that they did to all my siblings to try and fix their funky fallen arches. And but I didn't quite, I never have had the fallen arches. I've had the high arches. So boom, I was like in ballet, right? Say 30% of dancers have some kind of hypermobility with their connective tissue because it makes us naturally really great dancers.
Yeah.
So I always love that they're getting more aware of that.
Do you remember how you were processing this as an 8-year-old? Was it okay, let's do this? Or were your parents worried? Do you remember there being some anxiety around the diagnosis?
No, not really, because it was all so new. My parents were probably pretty good at keeping things away from me. They were really drilling like the heart stuff. I don't even remember an ultrasound. Luckily, ultrasounds are so uninvasive that it's a pretty easy one to keep monitoring for us. But what became a real pain was I had to do, my eyesight was just going down fast. And they decided that putting me in contacts. So by fourth, fifth grade, I had to start putting contacts in. And that was definitely like, are you serious? Because they thought that it would physically help hold the shape of my eye because our eyes just tend to go like long and skinny. Because conventional medicine has really been grasping for what can help for us for a while.
Mm-hmm.
And we find some things and then we go at it for a little while and we're like, oh, dang, that worked great on the rats, but not on us.
Yeah.
But no, I think my mom probably hid that back. My parents didn't quite get it because they let me play the sports I wanted to because I was always a little athlete inside of this smart body.
Okay. And you mentioned like there was some concerns about cardiovascular health. Can you just highlight what with Marfan syndrome,
what is the main concerns? Because, there's anatomical aspects of the aorta and the mitral valve. Can you share more about what the concern was?
Yeah, definitely. The main concern is the dilatation or the aortic root just continuing to grow out too much. Now, as growing up and how we had heard it, it was like, oh, we're so stretchy and we don't have elastin. That's what's happens. But then when I would go to the conferences and was in med school and I could understand what the newest stuff was and really the biomechanics there from Hal Dietz, the head a researcher for us for the most part, he was showing that no, the F beta that gets hyper triggered because not of enough fibrillin. So the
Hmm.
fibrillin gene mutation actually it's beta factor A, and so that overexpresses. So that'll go in and overexpress our really long bones, overexpress these arteries to grow a little too much by laying down, messing up the ECM, our extracellular matrix, so bad that our body has to lay down scar tissue to reinforce that because our connective tissue is just so messed up. So a cross look of our muscles is just all this unorganized layers. And so it's these unorganized layers of scar tissue that isn't stretchy, as we know, it's stuck. That's why we'll rip and have the whole dissection that you hear about. That's the worst, right?
Okay, so like early in those early days, were you going through a lot of imaging and um, cardiovascular tests?
They kept it for the most part. I looked good. So and they didn't have a whole lot and they weren't really pushing a whole lot back then. There were no medications. It was just once a year you go get your echo done and then we watch it. So luckily I wasn't growing, enlarging. So
Hmm.
we'll check on how big that is across.
Okay. And then what about like your spine and bones, and what were the discussions around that?
Growing up really fast. You just shoot up overnight. I would wake up with feeling like I had to pull my ankles back onto my leg, and the bone pains there were
Mm.
just tremendous. And then I have very knobby knees, and it was definitely the ugly duckling of just shooting straight up and then being stick thin,
Mm-hmm.
and it was like the scoliosis, luckily, was not that bad on me. And I was in ballet class that only reinforced like keeping a good posture, which I know has really saved me to this day, thanks to my CIA ballerina teacher. She was behind the Iron Curtain and brought over Baryshnikov style Russian ballet.
Okay.
Yeah. And she would hit us with a whip anytime our
Uh,
our butts were sticking out and everything. We're like, oh, okay. But now that way is not that's not helping me as far as pelvic floor health. But the dancing then helped me put together my movements easier too, because you're just so uncoordinated. We don't have that proprioceptor connection real well. So you might hear that we'll run into walls easier and we're a lot more
mhm.
clumsy. So that can be really tricky when it comes to uh, trying to get through those puberty stages that are just uncomfortable anyway. But luckily, I grow fast, and a lot of our fans we hit 6 feet tall, fifth grade, sixth grade. My my son's 6'1" at 12 years old. And so the poor kids, you forget that they're still 12 when you're looking at them and they look like they're 15, 16,
Yeah.
right?
Yeah. So did you go into dancing and ballet because of a Marfan as a way of dealing with it, or just did you have a special interest in it?
Oh, that was a special interest as well as a aunt that made sure that I redid all the stuff. And then she had amazingly been my mom's ballet teacher in
Hmm.
Redmond, Oregon, which was like 4 hours away years before. But I guess when you're ex-CIA, you have to keep bouncing around at little small towns.
How to
And so
stand out.
he didn't he didn't touch a lot of stuff in her house. But it was definitely something that was like everybody thought would help with my coordination, I think, too. But I definitely love dancing, but that one was really disciplined for me. Russian ballet style, very disciplined.
Yeah. So you're
But I
saying,
think it's great. Sports are great for these kids, and we're told or be active and get the muscle on us is really important. But too many times, oh no, you can't do any sports. You have to put a million protective gear things on.
mhm,
And I'm just really thankful my parents let me lead that a little bit more and let me do all the sports I wanted. I
yeah,
mean, uh, and the long term, I think it was good overall, but I did displace a hip in a basketball game in high school and came down at holy pop a hip out. Who can do that? So ever since, this left hip has given me
yeah,
issues.
yeah. So you're saying like it worked in your favor to be not held back and to explore how your body moves in space and kind of work with your body versus being restricted.
And I think that helps the beginning of the template for me for not following all the standard of care that they've done for Marfans.
Yeah,
I've
I think it,
never been on the beta blocker or the ARBs.
how are you doing today with everything?
Today, so I've been able to keep off the heart surgery is pretty much something you're going to face at one point or another. You just hope it's planned and it's not an emergency. And so I have the luxury of knowing I have Marfans for one, and then keeping and having the ability to get in for an echo every year and being close to great trauma centers. I do live far from them. They didn't like it when I was pregnant. Those were definitely some bumps for the medical system with me. They wanted me to not get pregnant. They don't want us having babies because this is a genetic disorder you shouldn't be passing along.
Hmm.
And then, too, they really want C sections because they feel that any of the valsalva, any of that pressure on my heart was going to cause me to rip open. Yeah, those are definitely interesting stories how I was able to get around that. But then, and even dilated a bit when I was pregnant, which is very normal, very natural. And that usually does come back down again. And mine came back down again. And then when my little one was little, they were like, okay, you're getting 5 centimeters is the magic number for how far they'll let that go. And then they want to do surgery. So I was like up over 5 pregnancy, brought it down to 4.8, 4.7, hung out there for a while, but they've been wanting me to do surgery, but I've been pushing it off for the last decade. But now it's popped up a little bit, and I think I better do it sooner than later while I am healthy and I can recoup. Nobody wants to do this. Nobody wants to walk in and go, yeah, let's put the chainsaw to my chest and crack me open
Right,
and
right.
cut out a slab and throw it on the freaking table.
Yeah,
I do need a part upgrade, so I'm grateful for our heroic medicine.
yeah. So what do they actually graft on a replacement, or how's the surgery work?
So it is, I luckily have a great surgeon who's very versed in this. He has done lots of Marfans, including members of my family. And it's called the David 5, Dr. David, Toronto, Canada, created this cool option of tying it onto the aortic valve. So what they'll do, so that it's a valve sparing aortic root replacement. And the top of the aortic root is where all 3 of the big supravena cabas
Mhm,
and stuff are coming in to the head of the heart. He's going to off right below that is where the big aneurysm and where the worst parts of it go. And they
mhm,
put in this tube that is a dicron material.
mm.
It honestly looks like a Chinese finger trick NASA material, and then he will hook that onto the outside of the valve ring with us. A lot of time, I'm lucky my valves actually look good. They're floppy, but they look good. But what's going off then is the shape, right? It's not staying perfect, and that's going to keep going off a little bit as they get older because we have big hearts and they still keep getting bigger. But I'll put a ring in, so I don't have to get a valve replacement, which is really what we want to do. We want to do everything we can to not have to take rat poison the rest of our life.
Right.
Coumadin and warfarin
Yeah.
really downgrades that life, that quality of life.
Yeah. Yeah. It's amazing. Like my first son he was planned to have surgery on his aorta, but that's a long story. But it was interesting
Wow.
to live with that expectation for a long time and to know it was going to happen at some point. And I'm curious like how you've held that. And it's such a balance between living in the present, living in the future. And have you had to do some transform with that, like in some way personally to deal with that?
Oh yeah. Oh yeah. Definitely. When you have it frees you up maybe to be more in the moment because you're like, I don't fucking know. I could be dead tomorrow. We could rip in the middle of the night. I
Right.
could pick up the wrong thing. My kid, ugh, yeah, right now I'm even more like concerned because I'm lifting them around. It was mainly after the angiogram. Weird, right? But oh my gosh, yeah, definitely. I feel like us with Marfans naturally have this like flexibility of all kinds, flexibility of mind to be able, and all of us seem to have this just like sarcastic, maybe dark humor of how we get
Mhm.
through it. I have patients that are in Ireland and Britain, and they definitely are on that line with me because that's their humor anyway. But overall, we're just like more compassionate too with other people and situations. So I think I'm like, oh, literally have a big heart. So I think there's something in the ability to just be chill about it. Thank God we don't have that high level of anxiety that gets built into Ehlers-Danlos and crossed over with the Marfans. Yeah, you could rip any day because I would be living on value. But no, it's amazing. I think though that has put me on more of a spiritual path than the doctor medical path though, really for me of why I have done a vision quest to being more open of a practitioner who's open for support and things. So I know that I feel like I'm going to be doing a little introspection here soon before my surgery because any kind of big thing coming up, it can help you get above that. And so
Mhm.
I think my early use of psilocybins and marijuana helped me get above everything and
Mhm.
go, yeah, life is what it is. I'm gonna get what I get, and a deep root in like my spiritual faith and stuff that I.
Yeah, amazing.
Yeah.
Yeah, you remind me a lot of one of my heroes in our profession, Dr. Leanna Standish. Do you know her?
Aw. No, I'm totally
Yeah,
writing her name down.
she's also a psilocybin researcher, and she was featured in the movie Spirit Molecule, and she's up here in the Seattle area and long time now. But why I said that is you're like someone who, because of your ability to like steer like fearful things in the face and live with holding that, it's I would want you to be my doctor. It's like
Thank
someone
you.
like that. And in fact, Dr.
Yeah.
Standish is someone I've called upon on various really serious moments in my life because of just that quality of being like able to stay in the moment in fearful situations or situations that aren't predictable, like an orderly and straight line. Like that's such an amazing quality.
To stay in the unknown.
Yeah,
Yeah.
like I always call it like stay in the pocket of life.
And
It's a
just go around where it takes you.
yeah, like you're able to flow and versus just check out. Polyvagal theory talks about shutting down and um, flight or flight responses, and
Yeah.
to be able to stay connected and here is like an amazing quality.
Thank you.
I
It is
mean,
definitely
I've
what
hit
makes.
that it's yeah. So thank you for sharing that because I've always wondered how that would be, and actually have lived it in a kind of aligned way, but not personally. So we've talked a lot about the anatomical effects, and you talked a little bit about some of the biochemical effects of Marfan syndrome. Are these elevations of inflammatory markers only in development, or do they persist through life? Or is there a biochemical, like biomarkers you can pick up in the blood, or inflammation markers you can pick up in a Marfan syndrome patient versus someone who doesn't have Marfan's?
That's a great question because I have found, as far as using LabCorp Quest, all our basic ones, and even our really cool outside the mainstream labs that we can utilize, the only thing useful are the genetic panels
Okay.
because I don't come up with HSCRP. It's not elevated. I know I get that question a lot like, oh, you should be on like SPMs all the time to kill that inflammation.
Mm.
And so, yeah, we definitely want monitoring inflammation as one avenue, but it almost seems if everything is there and happy, then it's not even, it doesn't go to the inflammation. It just goes into its messaging system of, okay, grow. And just in the matter of all the stuff that has to happen in an extracellular matrix, then it'll grow. But I don't think we have enough inflammation markers yet to really go in, or I haven't been utilizing specific cytokines like I really could for some things. But that's more because it's more of it's quality of life. And it really, the big marker is watching dilation and then improving quality of life and just keeping everybody as there's a lot of fatigue that goes on and such. So definitely watch that. Just random headaches because of the spinal fluid not flowing very well. And so I find that I'm that when pain comes up, then we're definitely going in and hitting with the anti-inflammatories. And God knows we got a lot of pain situations. The
So
fibromyalgia times 10, I call it.
okay, I'd love to get into the connection here in a second between other connective tissue disorders and Marfan syndrome, but going further into that question that I just asked, is has there been studies with like biopsies of tissue to look like what the I know you're talking about the lay down of the tissue, but is there any immune cells that are more populated, or is there any clues that tells us like what's going on deeply with immune system interactions?
No, that's a really good point, Doc, because we're constantly breaking ourselves down and rebuilding. So it's really like the deepest level of an autoimmune because it's
Mm.
on this connective tissue base in a genetic way where so there's going to be when there's some remodeling going on, then we're going to have that granular stuff kicked up, and we will be in that phase, so you could possibly find that out at times. But even I will work with some doctors to do prolotherapy with my patients, and it can go either way with us because if you're in a stage of that remodeling is already happening, and then you'll go in and kick on some not really recommended PRP because what do we want to reshoot our own bad cells into ourselves for? But maybe just utilizing the saline. I really like just to do the little trigger point shots, but there definitely seems to be a point with that remodeling on where it's a great time to do prolo and it's not a great time to do prolo, and
Mhm.
it can make things worse. But other times I see it be miracles and help those loose ankles that prevent somebody from walking be able to get up and move again, and really do huge for quality of life. So there's so little studies out there at this point. I'm having to be more like generally intuitive with it. Or, oh, are you having a high pain time right now? Okay, you're probably remodeling. Let's not, while you're in active inflammation, not do, say, prolotherapy or something that might be a little bit more triggering of the inflammation pathways. As
Yeah.
far as, no, I think we're all pretty excited that we just see these with MRIs and stuff, seeing that there is this kick of a breakdown of our own tissue, and then the scar tissue being remodeled in, and it'll definitely be kicked up a little bit more if there were a direct injury to the area, and we'll be more prone to go keloid when we're healing up our skin, or not heal up your skin and
Mhm.
have holes from an IV that are there for years. And so there's the healing is, it's no rhyme or reason on some of this stuff
Yeah.
too.
So
They
how,
still call it a syndrome, a
yeah,
collection of
yeah, I was gonna
it's
question that. Like,
definitely a
what,
disease.
yeah, yeah, it seems, it doesn't seem like a good description. It's like something that just was discovered as like a syndrome, and or
Right.
but
Antoine Marfan found it out in 1840. I think it's been around a
yeah,
minute.
yeah, exactly. So how do you see, you're seeing with your patients, like, not just, you're not only supporting the Marfan's community, but you're supporting connective tissue disordered community, EDS, and hypermobility syndromes. How do you see the overlap? Is there, are they all a family? Are they distinct?
They're very distinct. We all used to be one family.
Hmm.
And there's the treatments can be really similar for HSD, just the hypermobile EDS,
Hmm.
but still not. EDS, now that we know with the histamine connection,
Yes.
really puts it in category.
Yeah.
But yeah, they used to clump us all together, and we were just the weird connective tissue clan. And as we dive in farther and farther, oh, okay, so you're, low elastin, really hypermobile. Okay, you guys all do have some similarities here. The pot stuff, luckily, is just usually over in the EDS category,
Hmm.
the high anxiety, all these things with the high histamine. Now, I do see an issue with methylation being a problem too with a lot of Marfans.
Hmm.
And I swear that's just because, and in hypermobility, because our receptors are all off a little bit. It seems like if there's one genetic thing wrong with you, there's going to be a couple more genetic
Okay.
things going on. I've found a lot of us have ApoE gene for the high cholesterol.
Mm.
So thank God for Oregon grapefruit. We
Yeah.
love berberine, right?
Yeah.
And
You find that to
and
be
then
helpful for ApoE?
yeah, that's the only thing that's really found to stop the receptors from breaking down, from which is again like a Markin thing where it's a self breakdown. But ApoE can be across the board. It wasn't until I was able to do a lot of those Boston Heart cardiovascular
Mhm.
tests that threw in the genetics, but was affordable
Right.
for people to see these great connections of, oh my gosh, how many people have MTHFR, which tons of us do too. Anyway, that one. But then this APO, and looking back at my own family, we're like, oh yeah, that's why we have this skinny fat, high cholesterol issue. It's continually
Yeah.
recycling LDL and can't get out. Like, oh my gosh. So getting the
So
family,
important.
all that, and my Marfan people getting that tested and worked up.
Yeah,
There's
that's
some
so important with
right.
just heart health in general, is, and we're learning so much about, more about markers to look for, ApoB, lipoprotein little a, to have something that works on ApoE to lower LDL, one less burden.
You're gonna see pharmaceutical coming out with that real soon too, because they figured
They
out
love
that there's
berberine. Yeah. Yeah.
diabetic stuff
And pretty
and
soon
yeah.
we won't be able to prescribe it if the pharmaceutical companies get a hold of it.
I know. We'll all be out digging out in the forest again. That's one of the first ones I learned
Yeah,
to
it's
make
everywhere.
as an herbalist. They say we are the last good spots. I've been having people tell me, no, Oregon grapefruit's everywhere around you. But there is a berberine golden root plant
Right.
in every continent, right? If it's coptis to goldenrod and golden seal, then there's, and that one already went
Yeah.
down, right? The over harvesting. But yeah, I know. I get it. I'm really glad. But then the entourage effect of using an herb, the pharmaceutical company is just going to try and go, oh, here's the one active ingredient of herbaceous that we need. And like,
Yeah.
no, it's still herbs. You have to have everybody in there to play. So
Right.
we have those natural buffers that are put in, like
Exactly.
hawthorn for my Marfan syndrome. Oh my goddesses are not a herb that needs to be on board for just a daily for
Mm.
anybody with any cardiovascular thing.
Yeah, we learned way back that helps with like ejection fraction and other aspects of cardiovascular measures. Are you actually seeing that in
Right.
practice?
I've used it for easily a decade now. Was first digging in the rare book room there at NCNM and looking at how much has been really written on hawthorn and how important, as we know, the rose family is for the heart, and how it's the number one family that's grown with us and involved
Mhm.
with us to be a really important plant for us. And that self innate knowledge in it to know blood pressure stuff. I've used it extensively for anxiety and high blood pressure, to know too, like how to bring it down, but not bring it down too low, which
Mhm.
the standard of care right now with Marfan syndrome is to be on the two kinds of blood pressure medication. So they're on a beta blocker, metoprolol
Mhm.
is the big one. And then losartan is the ARBs, angiotensin, two that they got real excited about. But the scary thing is they're dropping down so low. We're already low blood pressure
Yeah.
because we have these adrenals that have their own issues going on and trying to keep things going. And so usually very low blood pressure already, and then they want us on a double that takes you down even low. So if nothing else, I'll use my hawthorn to try and prevent a bottom out on the blood pressure
Mm.
too. Not to mention the strength and the CoQ10 and improving that contractibility, like you were talking about with the ejection fracture.
Mhm.
I know it's really helped nourish the heart on so many levels there too, keeping the structure going on as well with it. And I think that's probably a lot of the flavonoids that
Yeah.
are naturally in hawthorn. And
Yeah.
yeah, so that one being so safe, it's really nice that I can put that one in my book or whatever and talk about it online because there's no contraindications with
Right.
that one for anybody on anything.
Yeah. And it tastes yummy as a solid extract.
Nice.
As an extra
Yeah,
bonus.
exactly. I agree. Hawthorn jelly.
Yeah.
Good
Well,
way for the kids. Yeah.
yeah. So how much is physical medicine part of your daily
Yeah.
practice?
I personally used to give tons of body work to people, but I can't do it anymore. I was told to stop a long time ago because I did like sports medicine, deep tissue,
Yeah.
and but that was my first introduction to heaven and my
Yeah.
first pain-free experience ever. Not realizing how much pain we think this is like normal because we don't know anything else. I guess breaking down yourself and rebuilding is definitely not, doesn't feel good. But
Yeah.
yeah, so massage and is was like, oh, it's so amazing. Oh my gosh, this is like an itch that never it's gotten. But chiropractic is
Yeah.
definitely a love-hate relationship.
Yeah.
That one can really mess you up hard if done wrong. But we need it in a lot of cases too, because we can go so loose to go out. The frustrating part with the pain is that we have to stay tight. Our ligaments aren't doing the job anymore. The
Mhm.
tendons are like out to lunch. So the muscles have to do the work to hold things together. So you'll have a new massage therapist that thinks, oh, I just got to really get everything loose and relax. But then you get up and you like go to sleep that night and you loosen and relax, and boom, that scoliosis just is worse now.
Mm.
Or the occiput here in the back of the neck, that's one of my big problems for not listening and snowboarding and such. And back in the day, we didn't have
Yeah.
helmets, right? Even with a helmet, you're still gonna get that part.
Yeah.
But so there's this even now as I get older, even with massage, and this really should be with any, we really have to how deep they go because we'll get off that table and it'll be like, whoa, I have to grab something usually because the proprioceptors have all shifted so much. It's wild to think how many connections are going on through the extracellular matrix. And I think
Mhm.
we're a great example of all the communication that goes on and how just the slightest little thing will
Mm.
be. So that's where like some of the people really like just the little activator that the chiropractor might use, or just using somebody who, like me, I would just slide joints back in by deep tissue massage and
Mhm.
just convincing the joint it wants to go in. And we're so loose, we will,
Mhm.
essentially. There's only a couple joints that you really have to. And I was at OHSU just a couple weekends ago. Dr. Guggenheim was talking there in the morning. Of
Yeah.
course, I didn't make it there because I wasn't there on time,
Yeah.
but they have talked again. Oh, first proof, 8 o'clock on a Saturday.
Yeah.
I live too far from the big city. But they're not recommending any kind of cracking anymore, and especially on the
No.
occiput. But that one is really hard if it goes out, how you get
Mm.
that one back in.
Right.
And sometimes I can on people, and sometimes that's where us having to be more at risk and just jump in and go, okay, let's see what happens. Personalities and go, all right, just crack me, see what it should work just fine. And usually it has with my chiropractors. I'm very picky about them, but body work and physical is definitely required. And it's sad, a lot of my patients have had bad experiences. So we have conversations about how to educate them, like we're always really needing to do in our own doctors. So we have to
Mhm.
really be good self advocates. And as soon as it starts to feel a little not good, just to listen to that, because we definitely can go beyond and then
Yeah.
we don't come back.
And how about Pilates practice or something like that? Is that really
Yeah.
recommended?
Yes, especially with the machine, if you can afford that, because that gives more support for things. But yeah, being very supportive, using extra kind of compression stockings or sleeves
Mhm.
and reimbursement K tape. Thank God that's out everywhere now. We can buy
Yeah.
sports tape and K tape. And even my massage therapist has been trained on how to tape that up and lock it in for people.
Yeah.
So, yeah, it's been really exciting to be able to utilize more of what's happening and what we
Oh.
can do for ourselves.
So for you, what do you find hopeful on the horizon, like that you're learning about at these at conferences and anything that is coming up in the research that you're excited about?
Oh, for me, one, it's the merge that we're slowly seeing the naturopathic kind of ways getting in the
Oh,
mainstream. And it's people demanding it, I think, for the most part. And they're being open and seeing, oh, this is working and helping. If nothing else, quality of life. That's what we're so great with. And bringing in the nutrition. There has been, I've had talks with health deets about mineral deficiencies being there. And I think and that being the reason for the spontaneous and being maybe a possibility to help bring that up. So that's something that is more like along my lines of things.
mhm.
One of but playing around with anything from the TGF beta antagonist, and not to throw down names, but they do have a patent. Metagenics has that THIAA they make from hops. It's
Oh, right. Yeah.
the tetrahydra iso alpha that they've done tons of research with for how it's messing with the signaling of TGF beta. And they're doing it mainly with pain, inflammation, and diabetics.
Yeah.
But I've been really trying to yell this for a long time. Like, you guys, we got to bring this on for Marfans. This reduces the expression, then we're going to slow down this horrible mottled scar tissue buildup we're doing
Mhm.
and breaking ourselves down. I, that's definitely exciting for me. And then that avenue, as my nerdy side really wants to see more of messing with the signals, genetics moving forward, and stem cells are now in the play.
Right.
I did stem cells to see if I could not do this. And there's some side, it's like Prolo, maybe. If you give it to me, did it make it better? Did it make it worse? Physically, oh my gosh, it brought my ankles back to me. My lungs that were always just down after COVID were like all back again. And I got some really great effects with that. So I'm excited to see us be able to utilize that more. I had most of my doctors really mad at me for self administering and doing that on my own, but they're used to me doing my things on my own
Yeah.
anyway, except for my Slovenian cardiologist,
Okay.
because in Slovenia, they do that. They do it right into the heart. And we
Wow.
have, yeah. So I'm like, so these international things, as they do that more over there, that's going to help us over here.
Yes.
Or the genetic testing they were doing in China, where Marfan's was the first that this has ever been done with, they had 8 Marfan moms that were pregnant with little Marfan babies in their belly. And they went in, since we know fibrillin 1 is the gene, and that's why they chose us, because I guess it's just really, oh, okay, it's just this one gene.
Hmm.
So they went in and they genetically, with the splicing, went in and fixed that. And 7 of the 8 did not have Marfans then when they were born, or
Wow.
in previous, and following them. Guess what happened to that lab? Shut down.
Yeah.
No more.
Hmm.
The CPP came in and took over, and God knows what they're doing now with like all that. But it was like, oh my God. But a part of me is sad we get to the point where there's never going to be any of these mutations, because there are positive effects that are figured out and down on paper, that we're just more open-minded and fluid and flexible in all kinds of ways. It's like intuitive to being able to be more brave about and laugh things off easier. I get nervous when we're like, get all excited to rule out all of our different cool things that make us
Sure.
human and different.
Yeah. I get
But
that.
I know as a parent though, you're like, oh God, do I want a kid that's going to have heart surgery down the road? If you could have that option, a lot of parents would like that for
Yeah.
sure.
Yeah.
But
Wow.
we definitely have a lot of exciting things for sure, as the integration of our medicines with the mainstreams come on board. Even when everybody's more open to, oh, I want to eat healthier. Oh, I will eat my root vegetables that are loaded with minerals, and my good fish and stuff now. And so I think that can actually start helping slow down the spontaneous that we're seeing more cases of.
Hmm.
So yeah. And
Yeah.
new stuff on the surgery table is always nice.
Yeah. I feel like we have to have a part 2 of this conversation, because this just really is just scratching the surface of, I can tell there's just so many different layers to this. You
Right.
you have your practice. Why don't you tell us about your practice, and also a little
Oh,
bit about
sure.
this ebook that you have that you kindly shared with me, and I'm so excited to read through it. It looks really
Oh,
amazing and
good.
full of great information.
Thank you. Yeah, that was based off of my thesis when I graduated my doctorate. It was definitely more nerdy, but so I was like, oh, let's put this in layman's terms so my patients can have something. And there's us doctors were repeating ourselves all the time. I was like,
Mhm.
nah, let's get something down. I don't want
Yep.
to repeat myself so much anymore. And the ebook at drmandolin.com. definitely, if somebody gets it, I'm happy, share it with your friends. I am really getting the information out there for people for the most part. And my practice is in a little town. I'm in a like 100-year-old brick building, and it's a lot of fun to have people either come in. Sometimes they'll fly in to see me because I'm unique enough, and it's really a blast to see different kind of people. But for the most part, it's really heart wrenching because I'll get people like, God, I'm so glad I found you. I have never talked to anybody, let alone known anybody that was a doctor that has these things. So that's really that I can be in their shoes and I know what they're going through. Everybody likes that kind of a physician for sure, more than yeah, so I was very excited to get out of primary care after doing that for 12 years and be able to focus on just the things I love to do now. Hormones, GI tract, I got brought in, and that really was healers down. Most people, that's like their first thing that they notice is off and wrong is this leaky gut and that
Hmm.
type of thing. And then yeah, no, connective tissue disorder. There's been a really great crossover where I've been able to really see things with using hormones, be able to really bring us our quality of life back quite a bit too.
Nice.
Estrogen and testosterone. It's just fabulous. I have a crazy case with a trans girl went to male. Symptoms went away when the testosterone was
Wow.
coming up on a higher level
Wow.
for him, that he's like, oh, I don't have these muscle pains and aches
Mm.
anymore. And my women, I just bring up our estrogen, and I'm like, we're keeping you up on a higher level, and we're just going to make sure we know how you detoxify and metabolize with the Dutch test. Love that one. And say no, don't be afraid of bioidentical hormones. These are definitely our friends out here. So
Yeah.
that's my practice, and it's really fun. And my brain, I keep getting more and more different things going on that I like
I
to
love it.
help experiment for them. But thank
Love
you.
it. Yeah. And do you do telemed too?
Yes, definitely do telemed.
That's
Yeah,
awesome.
I love consulting, and I'm being support for people from Australia to Ireland to the
Wow.
UK
Very
to be
nice.
able to find me because it's all kinds of people get Marfan.
Yeah. I love that. Like when you think about, you get out of the sort of disease model and you think about what's the body needing and, you know, how do we support, like you say, quality of life? You can see that there's just so much to offer: gut health, hormone health, mineral health, supporting minerals. It's just really just a perfect example of how the two worlds of medicine can complement each other.
Yeah,
And I mean,
right.
'cause obviously, a Marfan syndrome patient can't do without a cardiologist being on the team. It's just, and
As much as we might fight.
yeah, yeah,
They're
and
like, "Oh god, Amanda, you're just using Hawthorne for your beta blocker."
you're teaching them and educating them too. So that's, I'm sure they're learning a lot from you. But
Oh,
yeah, this
thank
has
you,
been
doc.
really wonderful. Thank you. Is there
Thank
anything you'd like to
you.
leave us with? We're going to put all the links to your contact information and social notes and even to like your supplements that you're developing and all that in the show notes. But I'd love to, if
Oh,
you have any
fun.
take home messages you've left. I'm very inspired by this conversation. So I'm sure other people
Oh,
are.
thank you. I appreciate that. I think that we all have a little bit more of intuition, so I definitely tell my loose connective tribe, like, I think there's a reason why you're more loose, be it, take, really appreciate that side and be careful about getting stuck in the conventional medicine because I'll see that route just continue to uh, get you stuck farther and farther down that rabbit hole, right? I would definitely bring on some of us alternative practitioners and a naturopathic physician who's been well trained in herbs, in homeopathy, that there's so much more there to offer, and get your support team on board And I have a free little grab thing for just on calypsoclinic.com. That's my Calypso name. Just a PDF of foods that are like that we need. More antioxidants and high minerals is really the thing there. And eating a lot because we're breaking ourselves down. We have to have a lot of small meals throughout the day
Mm,
and really make sure that that the kids are getting that. The little Marv kids, when they say they're hungry, they really are. Just keep eating them. They're
mm,
gonna put you take the credit cards out because that's what they cost to feed them.
yeah. Wow. Wow. Really good
But
insight. Yeah.
thank
So I'd love
you.
to revisit another time down the road to go into some other
Please.
elements. But thank you
It
very
would be
much
fun
for
to do
being
that
here.
with you. Oh, I appreciate you and your audience. Thank you guys so much. Please reach out. Happy to be of a service to your audience here any way I can. Get you
Awesome.
my email for them.
Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.